Para and Thora
by Ashley Lauer,
Dara Kelly,
and Michelle Grzinski.
Paracentesis and thoracentesis procedures are the drainage of fluid collections for diagnostic or therapeutic purposes. Collected fluid can be sent to the lab to examine the cause and determine if it is infected. A paracentesis is used to aspirate acidic fluid from the peritoneal cavity. A thoracentesis is used to remove fluid from the pleural space. Prior to starting the procedure, you must first obtain consent and lab values from the patient.
The consent process is used to ensure that the patient is informed of the risks and benefits that occur with the procedure. The patient should also know how the procedure will be performed and what physician will be performing it. Another physician, sonographer, or nurse must witness the patient signing the consent form. If the patient cannot sign the consent for themselves, other legal forms must be filled out in order to continue.
There are 3 lab tests used, known as a coagulation study, which measures the time it takes for the blood to form a clot. Prothrombin time, partial thromboplastin time, and international normalized ratio are the specific lab values used to assess the clotting factors. Mild coagulopathies can occur secondary to the use of blood thinners, so it's very important to check the patient's medical history. A timeout should be given immediately before beginning the procedure. This process verifies the date, the patient's name and date of birth, the procedure order, prior imaging and lab results, and the site of the procedure.
A paracentesis begins with the patient lying supine and the abdomen exposed. Each quadrant of the abdomen is scanned in a sagittal and transverse plane with the transducer remaining perpendicular to the floor. The largest or deepest pocket from each quadrant is imaged. It is important to keep your transducer pressure light because excess pressure can distort the true amount of fluid. The left lower quadrant is generally preferred as the abdominal wall is thinner and the depth of fluid is usually greater. Color Doppler should be used to show the vascularity of the abdominal wall in order to avoid major blood vessels. The radiologist may have you measure the amount of skin or the depth to the middle of the fluid pocket so he or she knows how far to insert the needle. Lastly, a skin marker is used to mark the spot intended to be drained as chosen by the radiologist.
A thoracentesis is very similar to a paracentesis, except it begins with the patient sitting upright while leaning over top of a table in front of them. The patient should be scanned intercostally on each side from the posterior aspect to find the largest pocket of fluid in the pleural space. The radiologist will use a puncture site 1 to 2 rib spaces below the level at which breath sounds are decreased.
Once the radiologist chooses the fluid pocket of their choice, aseptic or sterile technique should be used to prepare and complete the procedure. Sterile technique prevents contamination to the patient and to the specimen being obtained. A thoracentesis or paracentesis tray has all of the needed equipment inside, but must be opened using sterile technique by not touching anything inside without sterile gloves. Therefore, the outside covering of the tray should be unfolded using regular gloves. After opening the tray, the participating providers should put on sterile gloves for the remainder of the procedure. Antiseptic should be used to clean the area, and sterile covering should be placed over top of the site. The radiologist will use a UE needle that is ultimately connected to a tube with a needle on the other end. Once the radiologist inserts the needle, he or she will hand you the other end of the tube so that you can insert it into the glass vacuum bottle. During the procedure, the tube will need to be switched from one vacuum bottle to another once full. Once the fluid stops draining, the radiologist will ask you to check the draining site to see if all of the fluid has been drained. Use a sterile probe cover to check the area. If all the fluid has been drained, the radiologist will remove the needle from the site.
At the end of the procedure, collected samples should be appropriately labeled with the patient's information and sent to the lab. All sharps and glass should be carefully and properly disposed of into the sharps container. All other equipment may be thrown into the trash or into the red containers.
Risks associated with the procedure include bleeding, infection, hematomas, and pain. Pneumothorax can also occur with a thoracentesis, which is why many physicians will order a chest x-ray after the procedure to ensure the patient's lungs have not collapsed.